Welcome. And in terms of menopause, it's a pretty tough time. It symptoms really suck for the most part. And this is kind of when your body is starting to play hot or not, and the answer is it's always hot. And typically it's at unpredictable times, 3 a.m., disrupt your sleep, or in a grocery store, or during important meetings. I just want to get a show of hands. How many of you have experienced menopausal symptoms or have known someone who has gone through it? So everybody. Okay. So yes, it affects all women. Fun fact, hot flashes can increase your metabolism, but for a very brief moment. So you will actually lose a lot of calories during that time, but then it's gone. And so we are going to basically go through a lot of the common factors that, what it is, who is affected, what symptoms are there, and what kind of treatment. Okay, next slide, please. Okay, so menopause. So as much as it sucks, it is natural. Typically, it occurs around midlife, usually between 45 to 55, and the diagnosis is made when you have not had a period for a whole year, so 12 months. And during this time, your body will start to lose or start to produce less estrogen and progesterone, and these are the hormones that really drive those changes that you're going to feel and we're going to talk about. Of course, after menopause, you won't be able to babies either, so it affects your fertility. Even though it sounds simple, it's just really two of the main hormones that are dropping in levels. It can affect you physically, emotionally. All right. Okay, that's my first comment of the day. The doctor says, nice looking hot flashes are nature's way of lowering your heating bills so you can save more money for your retirement. I wish it looked like that. All right, next slide. Okay. So once again, it's very natural, the menopause can be caused by other things, however, that's besides the natural progression. So we just talked about the natural process. So the next point is surgical procedure. So what does this mean? So sometimes there are procedures that can basically drop you into menopause right away. Things like if we remove your ovaries, then that's the immediate surgical menopause. And we try not to do that because it feels horrible. Imagine all the crappy symptoms you felt over the years, and would just take you from there and goes to the worst kind of level. So that usually is sometimes cancer patients can have that happen to them, or patients who have had like ovarian cysts that's been causing them issues, and there was no way of saving the ovary, things like that. But in those situations, typically, if there's no contraindication, we will put the patients on hormones so they don't hate us, And then hysterectomy. Now, this an interesting fact is that hysterectomy, which a lot of people will go through, even when we don't remove the ovaries, so like we usually don't remove the ovaries with hysterectomies unless we have to, because ovaries are so beneficial. But even when we don't remove the ovaries, you can have an earlier menopause by like 1 to 2 years compared to if you don't have hysterectomy. Okay. So this is by definition the surgical menopause. All right. And then the medical treatments. So chemo, radiation, these can damage ovarian function. And so we can see like an earlier menopause in patients who are receiving those therapies. And these effects can be temporary, but can be permanent. So sometimes if you have like a short phase of chemo, once you stop, later on your ovarian function can return. And there are some medications used in breast cancer that can cause that as well, like tamoxifen. Then there is also the genetic factor. So if your mom or your sister or somebody who's had menopause, like in the 40s, usually you'll see like there's a trend that you'll be pretty close to that age. So sometimes I have patients who are in their early 40s, like I'm starting to get symptoms, and my mom went through the same thing. And you'll see that very often. Okay, and then primary ovarian insufficiency. So that is actually a condition that's slightly different from the menopause per se, but the symptoms are almost exactly the same. It basically is a ovarian failure where Sometimes you can even have people in their 20s to 30s who go through menopause because their ovaries are no longer functioning. So that's a completely different condition that often can occur with autoimmune disorders and chromosomal abnormalities. Okay, next slide, please. Okay, that's my second joke of the day. I keep finding all of those are bones for people who can't see it, and my doctor says boneless is normal. All right. Okay, and next slide. All right. Okay, so we're going to go through the symptoms. I'm going to stand over here. Okay. So the hot flashes and night sweats. These are going to be like the main symptoms we usually hear about that's affecting people that call them to seek care. This is the most common symptom, and it affects about 75% of the women. And typically, it's like a sudden surge of heat, and you literally can like sweat, and it can come on very suddenly, like unpredictable. Typically, it lasts like 30 seconds to a couple of minutes, and oftentimes you can feel like your palpitations, like the heartbeat increase as well. This can happen at night, and usually the common cause of poor sleep, where you're just up and you're sweating. You'll hear people say, I had to change my sheets and change my clothes because I just sweat a bunch. And this can last for a few years. And then it comes to the mood changes. So a lot of things I hear a lot, patients will say, man, my family is like, what happened to you? Like you're like a different person, you're so mean or something like that. They will say, they will report, don't identify yourself. So there is increased irritability, anxiety. You can have mood swings. You may actually go through depression, like real depression. And of course, your sleep is not great, so that kind of worsens the situation. But I tell my patients who have these issues, like, you're not crazy, because oftentimes they're like, there's so much guilt and there's so much self-blame. I'm like, girl, your hormones are going down like this. There is a cause for this. We can fix it. And you have to be kind to yourself, because that's a really hard time you're going through right now. And so should your family, okay? So, but that is basically what's driving these emotional ups and downs during that time. And so know that it's normal. If you're in your 40s to 50s, that can happen, okay? So if somebody tells you you're crazy, you're not. All right. And the next one would be sleep disturbance. So we just kind of touched on that. Usually patients can have difficulty falling asleep, or they can't stay asleep. Sometimes you'll hear they'll wake up and they're up for like 2 hours walking around, like they have to be on the phone and can't fall asleep. So those are very common. So in the day, you'll notice you're a lot more tired because of this as well. You can't, you're not resting well. Okay, the next one is physical changes. So it's funny because when I was preparing this slide, my husband was like, he was watching me prepare this, and he's like, oh my God, I'm like, yeah, it's coming, don't worry. Okay, so physical changes. So again, I want to emphasize that this is normal. And I think there's enough like self-shaming among women in general. And I think that you need to be kind to yourself. And I will emphasize that kind of throughout the presentation. So there will be weight gain. There will be weight gain. I want to say that, like, a lot of times people are like, oh my gosh, I gain weight. I never gain weight. And I think that it's not about maintaining the same number. It's about like perspective. Like, you should know that your body, if it has carried you through those years, it's going through change right now. And some things are not preventable, but we can minimize it. Okay, but there will be weight gain. So that's number one. And the main area of weight gain, unfortunately, is around the midsection, where nobody wants it. But that's usually where it is most likely to gain weight, is around the midsection. There will be loss of breast tissue, so loss of breast fullness. I know all the things you want, right? And then hair thinning can occur. There can be dry or thinning skin. You will start to have some joint pain, muscle aches, and so that's when a lot of times, this obviously doesn't make you feel like a happy person, so it all ties into your mood changes too. You're like, what is happening to me, right? So that is sort of the physical changes. And then, and I will be going through kind of what you can do to combat that. Again, it's about being realistic. You're not trying to be perfect. Nobody's perfect, but there are ways you can do to kind of make it minimal and not impactful. Then there is vaginal and urinary symptoms. So not everybody will go through all of those. And sometimes you'll just have the top ones, and you have just bottom few, so not all the time. So vaginal dryness and discomfort is one of the main vaginal symptoms. Now, not everybody will have that. Some people will just have the hot flashes and whatnot. Some people will just have vaginal symptoms, or vice versa. So oftentimes that will tie into painful intercourse. So if you're starting to have pain with intercourse you never did before, that's probably what's causing it. The vaginal dryness can be very, very uncomfortable for women. You can notice sometimes increased urinary frequency. Some people will have more UTIs. Again, that's due to the decreasing estrogen that's causing that. So in those situations, like talk to a gynecologist, talk to your doctor. Like it's not normal, but it's treatable. Sometimes we can give you hormone therapy that will help with that. And then cognitive changes. So yes, you will start the brain fog that you guys hear. That's kind of the main thing, is that you may start to forget things. Now, the good thing about this is brain fog is temporary. Okay. Now, so it's through that hormonal fluctuation, you will feel like you are more forgetful, and you can concentrate as well. Sometimes you may have issues with word finding. You're like, okay, I'm just thinking of that one word, I just can't remember it. But this is, again, temporary. So, okay, I better hurry up. Okay, got it. All right. Okay, so treatment. Okay, I'm going to try to go through this quickly because I want to just kind of hit each point so that everybody knows what they have option-wise. So hormone replacement therapy, very common, very beneficial. There's a lot of myth about it on the internet, so be careful what you read because not all of it is true. So hormone replacement therapy, typically we use estrogen and progesterone. Those are the two main hormones. Yet, do they have risks? Absolutely. Right. So you have to pick your patient population very carefully. If you smoke, I probably will not start you on it. I will counsel you to quit smoking. If you have high blood pressure that's not well controlled, I probably won't put you on it. But if you can get your blood pressure managed, even with medication, you can take the hormone therapy. Things like if you have had a history of stroke, absolutely no hormones. If you have had a DVT, like clots in your legs, no hormones. And there are other non-hormonal medicine that's available. SSRI, a group of antidepressants, is very, very helpful in vasomotor symptoms, so hot flashes and stuff like that. A lot of patients are on it. It's not a very commonly talked about one, but that is a good one to explore because it can target your mood and your hot flash at the same time. Now, it's in some people it's not as effective as hormone replacement, but it works pretty good. Okay, and then alternative medicine. So black cohosh is a herbal supplement that helps. Red clover, evening primrose oil, soy products, those are the things you can explore. It helps some, it doesn't help everybody. And then, okay, that was I'm confused. Hurry up. Okay, got it. Okay, so lifestyle. So this is key, and I have been trying to educate all the women that come through my office. I don't think it's talked about enough. You have to lift weights. You have to lift weights because what's going to save you from all this misery of menopause is lean muscle. It's not weight loss. And I want to say that it's not weight loss. You can do like 1,000 days of cardio. It's not going to help you as much as if you build your muscle. So go get a pair of weights today. Just start. Okay. So building lean muscle is going to help you reduce your hot flashes. It's going to make you feel stronger, healthier, and you're going to be more confident. It's going to also help you with, some weight loss, but the goal is not weight loss. And you'll have better bone density, more balanced stability, so you have lower risk of fracture. Okay, so and then all you need to do is about 5 days a week, start with 15 minutes a day, nothing crazy. Nobody has time to be in the gym for 3 hours, okay? And then, so bone supporting nutrition, make sure you are having vitamin D, calcium. Things that are really good are eggs, fish, and these are going to help you build stronger bones. Heart healthy foods, so nuts and seeds, plant oils, whole grain, fruits and vegetables, and plant-based protein, also very good. Weight management. Now, weight management, again, it's about setting expectations. We're not trying to lose rapid loss of weight, quickly. I know there's a lot of weight loss medications now, but be careful because that will lose muscle mass at the same time. So you're kind of working backwards in a way. So just kind of be aware. Not that you can't use it, but just know that it comes with that risk. You have to have protein. So protein is about 1.2 to 1.6 grams per kg. So that is about 85 grams. I did this math earlier, now I can't remember. 85 grams of protein for a 150 pound woman and who is not working out a ton. So that's a lot of protein. 85 grams per like most people are not eating that much. So that's how much protein you need to eat a day. Okay, and then healthy fats and complex carbohydrates, and then the essential nutrients. Iron-rich foods are great for this. Magnesium and phytoestrogen, which is plant-based estrogen. So soy is good. Soy milk or tofu, flax seeds, and legumes. Okay. All right. All right. So perimenopause. Let's get this. Oh, just want to say you can still get pregnant, by the way. Please use contraception. Until your period actually stops, you can still have babies. Yeah, we have some surprises, yes. Okay, let's go to the next slide. Okay, so there are a lot of support out there, and women don't know that. So come to us, come to your OB-GYNs. We're expert at this. Like we deal with this all the time. Okay, your family may not know. They don't know. And there are support groups online. There's organizations that help with this. There's a lot of educational materials on the internet about that. Mental health support, get it. If you see a counselor, see them. Okay, there's no shame in that. And then there are a lot of apps and digital tools that can help you track your menopausal symptoms, and so you can know what you're experiencing and talk to your doctor about it. Okay. All right. Next. Is it 5 minutes? Okay. Okay. So basically, we talk about the 12 months without periods of definition. Eventually, after menopause, your hormones will stabilize. You won't be crazy forever, just for a little bit. Okay. And then symptoms will go away. So usually after anywhere between 55 to 65, you'll see you're probably the happiest person in your family. Okay. There will be change in body composition. Now this happens to both men and women, so don't let them tell you that they're better than you. You will lose muscle mass, but again, you can work to gain. You will have more fat in your body composition. You will have weaker bones if you don't do anything to act. Okay. And make sure that you are seeing a doctor once a year to make sure you're doing well. You don't have to deal with bleeding anymore or pregnancy issues. That's done. And let me see here. Is that it? The last slide? Yeah. So I just want to touch on a couple of things. Do I have like a minute? Okay. So, and this is not going to be enough time to talk about it as a topic, but I wanted to mention there will be a decreased sex drive, okay, in menopause, and this is a huge topic, but people don't talk about it because people feel a little embarrassed or shy to talk about it. But I deal with this every day at my work. This is something I deal with my patients. So don't be shy if you have any issues. Come see us. It is also related to the hormone decrease, your sex drive is directly related, okay? And a lot of times during that time, you're also you're busy with your family, you have a ton of things that you're doing, and your to-do list is 100 things long, right? Nobody's gonna wanna have sex if they're trying to knock down their to-do list, right? So there's a lot of multifactorial, your mood is not great, your to-do list is long, your hormones are dropping, and your husband's probably what is wrong with you, right? So there's a lot of things that can be affecting that. So just don't blame yourself and just look for help, okay? All right, that's it.